Hello everyone, today we'll be talking about congenital rubella syndrome. So congenital rubella syndrome, which we also call CRS, it's an illness in infants that results from maternal infection with rubella virus during pregnancy. So what is it? That is maternal infection with rubella virus during pregnancy leads to an illness in infants, okay? So when rubella infection occurs during early pregnancy, there's serious consequences, which is miscarriages, stillbirths, and a constellation of severe birth defects in infants. So we're going to discuss these birth defects, okay? So the risk of congenital infection and defects is highest during the first 12 weeks of gestation and decreases thereafter. Defects are rare after infection in the 20th week or later of gestation. So usually in the first trimester, if there's maternal rubella infection, then there's a very high risk of congenital infection and defects, okay? Then common congenital defects of congenital rubella syndrome include cataracts, congenital heart disease, hearing impairment, and developmental delay. So infants with congenital rubella syndrome, they often present with more than one of these signs, but may also present with a single defect, and the most common defect is hearing impairment, okay? So most common congenital defects include cataracts, congenital heart disease, hearing impairment, and developmental delay. Then out of this, the most common is hearing impairment. And when we talk about hearing impairment, so we've got conjunctive deafness and sensorineural. So the one that's most common with congenital rubella syndrome is sensorineural deafness, okay? So symptoms and signs of congenital rubella. So because it's a congenital condition, so we need to know how does it present in the mother and how does it present in the infant. So in a pregnant woman, rubella may be asymptomatic or characterized by upper respiratory tract symptoms, mild fever, conjunctivitis, lymphadenopathy, especially in the suboccipital and posterior auricular areas, and a maculopapular rash. The illness may be followed by joint symptoms, okay? Then in the fetus, there may be no effects, but there may be death in utero or multiple anomalies, which we refer to as congenital rubella syndrome. So we talk about the most frequent abnormalities. These include intrauterine growth restriction, microcephaly, which means that the head circumference is less than the size it's supposed to be, meningoencephalitis, cataracts, retinopathy, hearing loss, cardiac defects, and the most common cardiac defect is patent ductus arteriosus and pulmonary artery stenosis. Then hepatosplenomegaly, bone radiolucencies. So these are the most frequent abnormalities. However, there are also less common manifestations such as thrombocytopenia with purpura, dermal erythropoiesis that results in bluish red skin lesions, adenopathy, hemolytic anemia, and interstitial pneumonia. Then ongoing observation is needed, that is to detect subsequent hearing loss, intellectual disability, abnormal behavior, endocrinopathy such as diabetes mellitus, or a rare progressive encephalitis. Then infants with congenital rubella syndrome, we may also develop immune deficiencies such as hypogammaglobulinemia. This is basically just a diagram showing the features of congenital rubella syndrome. So it's easy if you want to remember, you remember it from head to toe. So on the head counts is meningoencephalitis, microcephaly, mental retardation, and hearing loss 60%. See, it's quite common. Then glaucoma, cataracts 43%, pigmentary retinopathy. Then as we go down, congenital heart disease, such as PDA, which is 51%, pulmonary stenosis 18%, then hepatosplenomegaly and jaundice, and I've got thrombocytopenia and purpura, radiolucent bone disease, and other things such as low birth weight, which is 57%. So how do you test for congenital rubella syndrome? So diagnostic tests used to confirm congenital rubella syndrome include maternal serum rubella titers, viral detection in the mother via culture, and a reverse transcriptase polymerase chain reaction, which is our RT-PCR, of amniotic fluid, nose, throat, which is preferred, urine, CSF or blood specimens. And we can do infant antibody titers, which are measured serially, and viral detection. So treatment. So one thing you need to know is there is no specific therapy that is available for maternal or congenital rubella infection. So you need to ensure you counsel the parent adequately. And for the mother, you can give up immunoglobulin, okay? So how do you prevent congenital rubella syndrome? So vaccination in the majority of the population is effective at preventing congenital rubella syndrome. So basically, if the mother is vaccinated, she will not get rubella, and so there will be no congenital rubella syndrome. And for women who plan to become pregnant, the MMR, which is the measles, mumps, rubella vaccination, is highly recommended at least 28 days prior to conception. One thing you need to know is the MMR vaccine should not be given during pregnancy. The vaccine should not be given to women who are already pregnant as it contains live viral particles. And other preventative actions can include the screening and vaccination of high-risk personnel, such as medical and childcare professions. So that's all about congenital rubella syndrome. Thank you.